If you're new to Medicare or you already have Medicare, it's important to stay informed about Medicare updates that can impact you. In this video, I'll share with you some vital Medicare news and stay to the end of the video where I show you how you can receive Medicare updates from reliable sources. If you're new to my videos, thanks for being here today. My name is Joanne Quinn. I'm an insurance professional here to make Medicare a little bit easier, one video at a time. Let's talk about COVID-19 testing. At the time of this video, COVID-19 testing is covered by Medicare Part B. So in other words, Medicare beneficiaries have zero out-of-pocket cost for COVID-19 testing as long as your Medicare health professional ordered the test after February 4th. You'll have zero out-of-pocket costs, so you won't have to satisfy the Part B deductible and you won't have any co-insurance responsibility for this test. The zero out-of-pocket responsibility is in thanks to the Families First Coronavirus Response Act, which eliminates cost-sharing responsibility for COVID-19 testing and also eliminates cost-sharing for any associated office visits. In addition, Medicare Part B covers an FDA-approved antibody or serum test to see if you've developed an immune response to COVID-19. Now, although COVID-19 testing is completely covered by Medicare Part B, COVID-19 treatment is not. So let's break down who is responsible for what. If you're admitted into the hospital, you are responsible for the Part A hospital deductible and associated copays for your stay, unless, of course, you have a Medigap plan, which is also known as a Medicare supplement plan, to help cover those costs. And if you are done with your treatment at the hospital but still require quarantine, you can stay at the hospital under quarantine without having to pay an additional deductible for your stay. Now, if you require post-acute care at a skilled nursing facility, you are responsible for the copays associated with your stay, unless, of course, you have a Medicare supplement, also known as a Medigap plan, to help cover those costs. And normally, you do need to have a qualified hospital stay in order to receive treatment at a skilled nursing facility. However, if you cannot be in your home during COVID-19, you can receive treatment at a skilled nursing facility without a qualified hospital stay. It's also important to note that under Medicare Part B, your medical insurance, you do have responsibility for COVID-19 treatment. So your responsibility is to first satisfy the Part B deductible, which this year is $198. And then Medicare typically will pick up about 80% of the cost of your treatment, and you're responsible for the 20% co-insurance. Of course, if you have a Medicare, also known as Medigap plan, like a Plan F, a Plan G, or Plan N, it will pick up its portion of costs for any of your Medicare approved services. Also, in response to COVID-19, telehealth services have been temporarily expanded for some of your common office visits, such as mental health counseling or preventive health screenings, which is great. This helps you stay at home so you can avoid putting yourself at risk for COVID-19 or putting others at risk as well. And Medicare reminds us that Medicare fraud is an ongoing issue, especially at times when people are vulnerable and distracted, just like now with COVID-19. This is a perfect time for scammers to reach out to individuals. So please check your Medicare summary notices for any errors, or go online to your mymedicare.gov account and check your claims for any errors. And Medicare also reminds you that your Medicare card should be treated just like a credit card, so keep that number safe. And if anyone calls you asking for your Medicare number, hang up on them. That's what Medicare recommends, and I think it's a great idea. And if you're here watching this video and you have a Medicare Advantage plan, which is an HMO PPO type plan, I just want to note that you are still going to receive COVID-19 testing for free, just like anyone who has original Medicare. But what may differ is your treatment under your plan. So my recommendation is for you to contact your plan, your Medicare Advantage plan, to see how treatment for COVID-19 is handled for your situation. So let's talk about how to receive important updates about Medicare. I rely on several sources to send me email whenever there's news about Medicare. Now, if you're not interested in receiving emails, just stick with me. You can take down the information for each one of these websites and you can visit them on your own terms. Obviously, Medicare.gov is a good option, and you don't have to have a Medicare number. You just go to their homepage and you put in your email to get started. In addition to Medicare.gov, I like to get a little more in-depth information from some other sources, such as KFF.org, which is Kaiser Family Foundation. The Kaiser Family Foundation is a nonprofit organization focusing on national health issues. You can sign up by selecting the mail icon or scrolling to the bottom of the webpage. You can also visit MedicareRights.org. This national nonprofit consumer service organization works to ensure access to affordable health care for older adults and people with disabilities. To sign up for email notifications, go to the homepage, visit the Medicare Rights blog, and sign up on the side of the page. And lastly, I also get updates from MedicareAdvocacy.org. Established in 1986, this is a national nonprofit, nonpartisan law organization that provides education, advocacy, and legal assistance to help older people and people with disabilities. To sign up for updates, select the sign up button at the top of the webpage. Again, if you're not interested in giving out your email address, you can save any of these websites to your computer, your iPad, or any other electronic device that you use, and then just check in periodically for Medicare updates. And if you found this video helpful, please feel free to share it with anyone you know who can benefit from this information. And I encourage you to continue watching more of my videos. And if you're new to Medicare, please feel free to sign up for my free Medicare e-course, which just puts all the pieces of the Medicare puzzle together in an easy format. Thanks for watching, and I'll see you next time. Treatment. I'm getting there. Okay. By your Medicare part and are not at immediate. And oh my goodness. Ooh, what's it called? Now, if you resign. Here. Oh my gosh, am I done?